and thank you for joining us today for why predicting health risk is key to your business success. I'm Cara Tarantino, VP of Marketing for Orthus Health, and I'll be talking to you today along with my colleague, Mark Ruby, Vice President of OEM Sales, also with Orthus Health. We're thrilled to be part of the new Orthus Health, 3 companies strategically merged, so our talents, expertise, and technology in wellness, health risk prediction, analytics, and clinical oversight could bring you even more effective and data-driven, performance-based services, metrics, and insights. Orthus Health was formed in 2017, but our story begins many years earlier. In 1945, merely 11 weeks into his 4th term as president, Franklin Delano Roosevelt died of heart failure and stroke after a prolonged illness of uncontrolled hypertension. Following Roosevelt's death, President Truman signed the National Heart Act into law, granting funds for the 20-year Framingham Heart Study. The term risk factor originated from this infamous study, and prior to, physicians had little awareness of prevention. Too late for FDR, his risk factors remained undiagnosed and untreated. Fast forward to 1983, and in rural China, the China Cornell Oxford study was born. Here, great emphasis was placed on balance and restraint, and overindulgence frowned upon. In fact, children were taught to stop eating when they felt 70% full. Food was locally produced and distributed, and the diet was primarily plant-based. The study uncovered 8,000 statistically significant associations between lifestyle, diet, and disease. The higher the diet in plant-based foods, the lower the risk of disease, with dietary pattern playing a role in disease causation as well. Both of these studies gave rise to synthesis analysis, a newer disease prediction model with the ability to gather data from multiple sources instead of a single source as is typical. Synthesis analysis included many more risk factors previously unknown at the time, such as family history, physical exercise, and body mass, among others. Then, in subsequent studies, this model was proven to outperform the original Framingham risk score model, offering an improved way of predicting disease. From synthesis analysis, tongue twister, the outcomes-based Know Your Number Health Risk Index emerged. Both synthesis analysis model and Know Your Number are patented and now owned by Orthus Health. The effectiveness of the Orthus Health disease prediction model is more important today than ever before. Heart disease is responsible for 1 in 3 deaths, diabetes plagues 30 million Americans, and increasing obesity plagues not only Americans, but now the Chinese and others worldwide. The impact on worker health, culture, and the ability for businesses to thrive is significant. Let us show you how predicting the health risk of your employee population can help you predict future costs, guide you as to where to invest in wellness and other interventions, and how it can help chart the course of your business and those that you serve. Today, we'll focus on the importance of predicting, quantifying, and communicating health risk, which includes both disease and injury risk. In order to effectively address both disease and injury risk, you need the most effective outcomes-based assessments proven in both clinical studies and in real life. Mark will now take you through the Know Your Number Health Risk Index. Mark? Mark, are you there?
Yes. With Know Your, with Know Your Number, one of the key things we bring to the table is we're able to educate the individual as to their health status. And as we go through, we'll show you the output of the individual report, and we'll also talk about the type of information at the aggregate level we bring to the employers. So the key thing is what we do is we quantify risk, both at the individual and the population level. And we also do a very effective job of communicating risk And by being able to communicate what your health risk status is, we're able to increase motivation and improve engagement. And then obviously educate people as to how they can make changes and how organizations can strategically focus on programs that will have the greatest impact. And at the end, we're able to document results, both at the individual level, so that basically the individual is able to see how it impacts their health status, and certainly at the employer level, we're able to document outcomes that supports ROI and the health programs that are associated with that. So yes. Now what I'd like to do is really talk about the individual. And to me, healthcare really starts with the individual. And we have Joe here. And one of the real questions is, what's really driving Joe's engagement, or how can we get Joe to actually engage, in improving his health status? And what we find certainly in employer wellness programs, and when screenings are done, it's not unusual to see 30 to 50% of the screened population do not have a primary care physician of record. It's heavily skewed towards men under 50, but these employees have good health care. And so what you have is a lack of engagement. And so in the employer wellness program, generally when somebody does go through screenings, they get kind of the health risk assessment, biometric risk factors that would indicate, okay, do you have high cholesterol? Is your BMI level too high? Blood pressure? And generally there's kind of a general health score that's provided. The problem with that is that it really doesn't paint the full picture. For people to get engaged, they really need to know, well, what does this mean for my actual risk for getting disease? There has to be a call to action. And so really what Know Your Number does is it really paints the full picture. We're able to really show people the key health risk actionable knowledge that's really going to help them to get engaged. And that's really the call to action. And so with that, I'd like to move to the process with Know Your Number. And Know Your Number works the same way as typical health risk assessments. What we do is take the same information, similar questionnaire, the same biometric and clinical measures, and what we're able to do is actually take that information and convert it into a very actionable format. The one-page report basically really provides the individual with not only their biometric values, but more importantly, the call to actions. How does this impact my risk for disease? What's my total health kind of status look like? And more importantly, how can I go about making changes to improve that health status? We also focus on the 6 primary diseases that drive the majority of health costs in this country. They also are highly avoidable. So the individual, can basically be a major player in actually reducing their heart risk. And I might add that 60 to 70% of the new cases of heart disease, stroke, diabetes, et cetera, that occur in this country every year, 60 to 70% of those cases are based on modifiable risk factors. So obviously a significant amount of costs can be avoided by getting people engaged. So I'd like to move to the individual report. And the one-page report is very informative. The upper part really reviews the biometric risk factors. People are very familiar with what cholesterol means, what BMI means, what blood pressure means. But what we do is we take that information plus the information off the questionnaire, which looks at your personal health history. Do you have diabetes, heart disease, lifestyle information, and whether you're a smoker and how long you've smoked. We actually take that information and convert it into actionable information. And we look at your actual risk for getting disease over the next 5 years. How much of that risk is modifiable? And also, what's your peer group risk? So what does your actual risk for the various diseases mean from a peer group status? And what we do is we really put it into kind of a picture format. And so with Know Your Number, we provide kind of a unique window to your internal health status. So we look at what's your disease risk, and more importantly, how does that risk impact your ongoing health? So with that, we start with the KYN risk tracker score. This is your overall kind of score based upon your individual risk for getting disease. And so this is something that that's easy to compare, and you're able to track risk change year over year, both at the individual level and also looking at the aggregate level for organizations. And so as you reduce your modifiable risk factors, you're able to see the change in the lowering of the KYN risk tracker score. So it's a very unique type algorithm that really looks at your combined risk. And so once somebody really understands that, what we'd like to do now is move to the next part of the report, which looks at the individual disease risk that you have. And so with this, we have an example of Joe's 45. And if we just look at diabetes risk based on Joe's risk factors and how he answered the Know Your Number questionnaire, his 5-year risk for getting diabetes is 14%. And the second line on the table is how much of that risk is modifiable, because our algorithms are able to look at how modifiable risk factors impact total risk. And so 89% of that 14% actual risk is directly in Joe's control. And the third type of risk on the third row is their peer group or percentile risk. So Joe is a 45-year-old man, and so individuals the same age as gender, obviously as Joe, he has a 90%, basically he's in the 90th percentile for peer group risk, which means 89% of the people same age as gender as Joe obviously have less risk. Why is that important? Because individuals are not familiar with actual risk for disease, and so it's hard to understand what that baseline is. So if somebody said, hey, Joe, you have a 14% chance of getting type 2 diabetes in the next 5 years, there's a good chance he's going to flip it and say, I have an 86% chance of not getting it. But in reality, that 14% is extremely high, and so that's why it's important to show peer group risk. Also, people understand peer group risk. So in the first bar chart here, below here, we actually show Joe's peer group risk for getting the various chronic diseases. So very quickly, Joe has kind of a unique window into his internal health. He's at a relatively high peer group status for the majority of the diseases and above average for COPD and lung cancer. The good news is Joe can get his risk actually down to the green bars, which means if he gets all of his modifiable risk factors down to the top of normal, he could actually eliminate a lot of his absolute risk for disease. So now let's go to the next slide, because once you've got somebody engaged, the key question is, well, how can I change? And Know Your Number basically provides that pathway. We're able to actually identify the individual modifiable risk factors and how much they individually contribute from a modifiable risk standpoint for the various diseases that we look at. So Joe's a smoker, and so you can see here in the gray part of these bar graphs, this is how much smoking is contributing from a modifiable risk standpoint for the various diseases. So very quickly, Joe can see not only from smoking, but from weight, which is purple, mauve is blood pressure, cholesterol is green, glucose is, cholesterol is kind of blue, glucose is green, and exercise is kind of the yellowish orange. Joe's able to see these risk factors and how much they are contributing. So it really starts the pathway to change. And so somebody can pick a risk factor that they want to focus on and start that change process. So what we're able to do by going, let's move to the next slide, is we're able to answer the question, how can I, getting, as far as get engaged and what's in it for me? And so what we're able to do is really provide kind of a 360, kind of overall picture of Joe's health status. So it starts with his biometric risk factors, and several of them are high. Well, what does that actually mean for my overall risk for getting disease? And so he's in the high category, so he's obviously carrying a lot of risk. And so now what can I do about it? So I need to understand what my disease risk is, from a standpoint of a peer group. That's motivation, obviously, and it fills a significant gap in healthcare knowledge. And finally, most importantly, it's really showing the modifiable risk. What can you do to change? So we kind of give a unique window and kind of a unique pathway to change. And so what this does is it increases certainly the opportunity for somebody to get much more engaged, because now they know what's coming down the road in the next 5 years. And so a huge amount of it's avoidable. Next. So one of the key things with Know Your Number is we're able to really document change. And so one of the questions is, okay, you've kind of educated me. Well, how hard is it to make a change? You know, do I have time? What, all these other questions, that people have here. Well, one of the key things is even a small change can lead to some significant improvement in health status. And so Know Your Number has the ability to improve outcomes even without health intervention, because it's a great education and engagement tool. It kind of fills that gap, as I said before, and it's a critical gap in healthcare knowledge. So let's go to the next slide, because what we want to show is that, in fact, just a 5% change in Joe's biometrics. So in other words, over a year's period, we're asking Joe to lose 10 or 12 pounds and lowering blood pressure by 5 or 6 points. So we're talking about small incremental changes, but collectively, it can mean a big difference in your overall health status and reducing risk. So Joe, in fact, this is looking at year 1, year 2. You can theoretically, you can actually move from borderline high to above normal, almost 10 points on the risk tracker scoring chart, just by making small changes in your actual biometric values. So this is a great way to really document outcomes for the individual and able to show them that, in fact, making those changes can result in some significant health improvement. As I mentioned, Know Your Number, has important, information for the individual, but that's also true for the employer. And so once a population's been screened, what we're able to do at the aggregate level from a baseline is we're able to not only look at biometrics, but we're able to predict the future avoidable disease burden in that population by the number of cases that will occur. So we're able to show them the total number of cases of, say, diabetes, heart disease, stroke, but more importantly, how many of those are avoidable. We're also able to show exactly which risk factors that are modifiable that are driving those avoidable cases. And we're also able to show them where those avoidable cases are coming from in that population. Again, this is de-identified, but what it provides is kind of the same kind of window to the internal health for the employer of their population, and more importantly, providing them critical information from a health standpoint to really help strategically in focusing on where should we be adjusting or integrating or developing new health programs to really address, the avoidable disease and also cost in that population. Because the two things we bring to the table is we're able to look at, your future new disease burden and also the cost burden, both a total and avoidable cost in cases. And so when you run Know Your Number on a population in time period 2, say the second year, we're able to actually show the outcomes from that cohort who basically took Know Your Number time period 1 and time period 2. So we're able to show the change in biometrics, change in the number of total and avoidable cases in that population, total and avoidable cost burden, and really able to show where those outcomes are coming from. So we're able, from an unbiased standpoint, we're able to document outcomes to support the ROI of those programs. So we're a great tool to establish baseline in a population. From an accountability standpoint, the employers have now an unbiased scorecard to really help, hold those vendors who are providing their wellness services, from an accountability standpoint, saying, are you improving outcomes? And so finally, if we look at know your number, and if we want to sum this all up, is K1 establishes kind of a baseline health window, both at the individual level and certainly at the aggregate level for the employer. It allows the individual to focus on what can be modified. So again, we show them that pathway to change and how much the modifiable risk factors impact their actual risk for disease. Do the same thing for the employer. They're able to see, you know, the modifiable risk factors and where those avoidable cases are coming from. So again, weight drives a lot of disease risk. Blood pressure drives a certain amount, et cetera. So we're able to provide that same kind of pathway for the employer as we do for the individual, which means you're able to offer it what we call relevant programs that can have impact, because you know by putting these programs in place that you have the highest probability of reducing avoidable cases of disease. And obviously at the individual and employer levels, we're able to evaluate results. So the individual year over year is able to see the improvement in their health status with the Know Your Number report. And at the aggregate level, the employer now has a way to document outcomes in a very unbiased way. And I think finally, when you look at claims, running Know Your Number and also having claims available gives you that 360 approach on both the individual level and at the aggregate level. Okay, Kara, I'll turn it back over to you.
Great, thank you, Mark. There's a lot of detail here, a lot to absorb in a short amount of time. So just wanted to give you an overview of really the practical benefits and solutions with Know Your Number. Quantifies and communicates in order to align actions to personal values and goals, which is very critical to engagement. I know that's the question that comes up time and time again, is how do we keep people engaged, keep them get them to take these assessments, retake them, and do what they need to do in between. We've also seen that this is a tool that guides people in taking action because they have increased confidence from the changes that they're making. As Mark indicated, documenting outcomes is key. It also provides information to individuals so that they learn the right questions to ask of their physicians. They become involved in their care. It prepares them for change. And the other thing that we've seen is it significantly reduces pushback for any type of employer-sponsored wellness programs. Some other benefits are you want to be able to target interventions by location, by business unit, even within the same company. Not all locations operate, their cultures are differently. So this is a key assessment to that end. It's not tied to any benefit plan year, so we could start this at any time. And the other thing is when we talk about the type of interventions that you want to invest your money in, these really, the KYN really leads to increases in productivity, reduction in absenteeism and presenteeism. And we know these are big issues for any employer. Just to give you an idea of how real these costs are, here was a study that was done that indicated lost productivity costs are 2.3 times higher than medical and pharmacy costs. And as you can see, the amount of costs attributed to presenteeism is significant compared to what we're paying in healthcare costs. And just to give you kind of a real world view on where costs are coming from and how we want you to invest your dollars in assessments and programs that have the biggest likelihood of being acted upon, this is where we want to focus our efforts. I mean, diabetes is #1, with 58% of those costs being spent on pharmaceuticals. I included the top 7 because falls is the only injury that was on the top 20 list of costs But again, they're significant costs, you know, and they significantly impact workers' comp claims. So what we like to do is really take a harder look at the modifiable habits, and they do require our input. They do require us to take action, but they are something we can do something about. So when you look at these habits, they are the drivers to 14 conditions that account for 80% of the total cost of all chronic illnesses. So once you kind of put this in a snapshot view, you really see that it is worth us together, you know, hospitals and health systems, employers, brokers, vendors, to come up with ways that are meaningful and relevant to individuals. So if we want better answers, we got to ask better questions, and we need to use better assessments. Mark did an excellent job of outlining KYN, and I'd like to just briefly show you what we offer on the injury prevention side, to include a safety risk profile along with a disease risk profile in our total health risk profile that we want to offer to you. Today's worker is 13 pounds heavier than they were 10 years ago. There's a significant problem with low muscular strength due to disease and due to increasing obesity. This test assesses shoulder strength and knee strength, and it's really not just for manual labor industries, but we're seeing issues with musculoskeletal disorders in technology companies as well. So we feel our efforts are really best served in focusing in on looking at muscular strength as a precondition that we can do something about. And as you can see, the costs are significantly higher for an employee with a weak strength strength to BMI ratio. So what happens after you do these assessments? People need the right relevant support. They need a platform in the form of a portal or some foundation in order to view their current health status and their history over time. This is just kind of a brief overview of some of the support programs that we offer. We want you to know that our assessments, our metrics and insights platform work with any vendor and any provider, but we also offer the relevant lifestyle and disease management support as well. We also, in addition to providing a member platform, we have a back office coaching platform, because some of our reseller, especially our health system clients, like to put their own coaches on our platform as well. And our platforms talk to each other and provide ultimate service and support for members. We recognize that you want everything to be private labeled, and so we are the behind the scenes mechanism that gets it done. And you need flexible options. So at Orthus Health, we believe, and I really feel strongly about letting you know what our drive and our purpose is. We want to support your goals and objectives and those that you serve. We believe health is personal, and every person has the ability and should have access to understanding the current state of their health in order to improve quality of life, not just quality of health, but quality of life. We believe loyal, productive employees are at the core of every positive workplace culture, and we want to help employees be the best version of themselves. And we believe informed communities are critical to the survival of local health systems. There's a lot of education that needs to take place, and we want to be your health resource in that regard. And then on a final note, many years following Roosevelt's death, his cardiologist remarked, I have often pondered what turn the subsequent course of history might have taken if the modern methods for the control of hypertension had been available in 1945. So we truly believe that indeed prevention could have altered the course of US history and can alter it today. So I thank you for your time. We really look forward to meeting with you one-on-one. We look forward to lots of questions and continued conversations. And we will be following up with you following the presentation. And we also look forward to sharing some more time with you on subsequent webinars. So thank you very much.